Good morning, everyone. It's AnnMarie here. Happy Wednesday. I hope you're enjoying AMC Connects. We've had some pretty informative episodes the last two. If you haven't tuned in, we had some time with Scott Burns. He was back as a special guest to talk a little deeper on the Rural Health Transformation Grant, the stabilization side that we were awarded. Again, if you haven't tuned in, he gave some really important updates about his new role in being a community champion. We also had Jody Wallace on, who was a new guest on the episodes, and we were deep diving in terms of workforce and how important you all are to the organization and her passion there. That was a fun conversation. She was well prepared, wasn't she, Chuck?
She did fantastic. You don't understand. She came in, and if you know Jody, she has a great heart, great person. She hates me and cameras when we're together. If it's just me, she's fine. If it's a camera, she doesn't like me too much. But she did fantastic.
She did. Thank you, Chuck. She did do fantastic. She was a tough talker in terms of getting her here, but she was amazing. Please tune in. If people don't know Jody really well, I can't imagine anybody who doesn't, but if you don't, she's pretty cool in how she puts pieces together, but certainly her passion on workforce and that deep dive and meaningful conversation was fun. So tune in to her. I don't know if you're noticing some changes in the studio. Chuck is just doing an amazing job upscaling us so nicely. Thank you, Chuck. But a quick question for you. As the episode marches on today, please take note. And if you notice what's changed in our recording and in our time together, please make sure you announce it in the mailbag. If you do, Chuck and I will have a prize for you. So that's a little test to get the mailbag going again. As always, the mailbag is really pivotal in making sure that I hear from all of you in terms of comments, feedback on how the podcast is going. I think we're over 13 episodes now. So kudos to Chuck and everybody who's tuning in.
Kudos to you.
Yeah,
It ain't possible without you.
Aw,
It'd just be me looking at the camera and not saying anything.
Thank you, Chuck. Yeah, but what keeps me going is certainly the flurry of opinions, comments, and feedback. And so please use the mailbag, but just for fun, if you do notice what's changed in our environment here, please put it in there. We do have a great episode for you today. It'll be pretty packed, particularly in the beginning. And of course, we have a great guest with us, but two strategic topics that we're going to go over and explain a little bit more about. So stay with me, everyone. Welcome back, everybody. So 2 strategic topics to go over in this week's episode. We do want to do a Haney's briefing before I go into those, but again, stay with us the whole time. We'll talk a little bit about some information that was updated and launched with our EHR work, major strategic topic for us that we've talked about in the past. And we want to go into growth. How does Rome Health growth? How do we position things? I've had some questions when I've been out and about in the community on some certain topics around how Rome Health positions itself for growth. Before we go into that, as a reminder, we reference on our time together that we do have a couple agencies that advocate in New York State. The Hospital Association of New York is one of them. They do a great job in making sure that the high priority items that are important to healthcare in New York State are positioned well in terms of advocacy. And so they do a great job in giving briefings. I've gone over that before. So this is the latest. Just some quick updates. We do have the budget that is underway. I think Haney's calls it the budget dance begins, and a number of high priority items that the governor and therefore the New York State budget has to balance. Healthcare is a big part of that. So we'll continue to hear more and update all of you, and I know you will know. State lawmakers push insurers to spend more on primary care services. This is good to hear, and probably a good backdrop for our guest discussion today as well. But New York health insurers would be forced to boost their spending on primary care under legislation that state lawmakers rallied around behind on Monday in March as they seek to shore up preventative health care services amid looming federal funding cuts, which is, we've talked a bit about on previous episodes, is a bit of a concern for New York State and certainly for Rome Health. We do a lot in preventative health care, particularly through ambulatory care services, primary care being one of, if not the highest priority for us to reach the community. In some federal news, a judge strikes down RFK Jr.'s vaccine policies in blow to Trump's health agenda. So, ruling on a lawsuit brought by several prominent medical organizations, a district court said the federal government had not based its decisions on science in limiting COVID shots and revising the childhood immunization schedule. We've talked a bit about that quite a few episodes ago, I think, right, Chuck, when we had Dr. Attilio on. Mm-hmm. Dr. Attilio gave his opinion on vaccines, and it was nice if you need to refer back to that episode, or maybe Chuck can throw it up for us.
I will say, to be very clear to everybody, I'm a huge vaccine proponent. I remind my patients oftentimes that, especially with military service, I've been vaccinated against things that most people haven't even heard of,
sure.
Right? So that's not just a personal opinion. Mm-hmm. There's a lot of literature out there, a lot of very well done healthcare research that says vaccines do work and they provide significant benefits to us as individuals and as a population, right? Now that said, I also remind my patients that, when you come in to see me, your body, your health is yours, right? Mm-hmm. My job is to guide you through what I believe is going to help you live the longest, best life that you can, right? But it's your decision at the end, right?
Another topic, reproductive health clinics scramble as Title X funding cliff approaches. Title X is a 56-year-old federal grant program that supports thousands of clinics that provide birth control and STI testing and treatment. Those clinics could face a funding gap because of the Trump administration delay, according again to Haney's briefing. Other news and opinions, prove it to me. Hospital CFOs get more involved in tech deals. This is kind of interesting. CFOs are playing an increasingly active role in vetting and implementing technology initiatives, with finance and other departments in the room. Executives are gaining a broader understanding of a product's true impact and how it fits into the system's overarching strategy. Kind of an important topic, probably a great segue into our update. As we've talked about several times, we have a major strategic initiative to update our electronic health record. We've had guests on. That was a Dr. Attilio as well topic, as well as Sarah Grokowski. Did a great job on a previous episode. If you want to tune in, if you haven't seen that one or heard that one, it was really great to hear from her as an internal leader. Well, I liked that particular topic that Haney's talked about because things aren't always what they seem on the surface. Nothing against tech companies. They're doing a great job. Incredibly creative and innovative. We probably can't go a day listening to news or in the community where we're not hearing about AI, we're not hearing about different technologies. And in healthcare, it's been a pretty fast 25 years as technology has really inserted itself into the healthcare realm. And that certainly applies to our electronic health record as well. I'm really proud because Dr. Attilio, Nancy leading us through, and Ryan Thompson, our leaders sponsoring our particular project plan here at Rome Health, right from the beginning. We've had finance at the table. Nate Smith does a great job in carving out time, as well as Tabby Signorelli. I think she touched on a little bit with us when she was with us. But we have our finance experts right at the table, evaluating our program and our project right from when we were applying for the grant. As everybody knows, we've received substantial funding. Thank you to New York State Transformation Grant and Cassie for us being awarded with that. Without further ado, I'll do a quick backdrop. Back in the beginning of February, Cassie did a great job with Nancy Levitt of announcing some of our guiding principles, and just a brief reminder on those. We do have formulated some amazing guiding principles that will help us make the decision. We may think we know what's best for Rome Health in terms of an electronic health record solution, but it was really important to make sure what's deep within the culture and fabric of what we're trying to do for ourselves, for the community, was well ironed out when it came to driving forces. So as a reminder, we have some basic guiding principles: safety and security, The safety and well-being of our patients is of our highest and first priority. We want to make sure that our systems are sound and that we're updating safety and security. Clinically and operationally driven, many people, when you launch technology or an EHR platform, we put the burden on IT. Here at Rome Health, we're putting the burden on all of us. Our expertise in any given role really matters. So the design, implementation, and the ongoing health information steering committee and system maintenance decisions will be clinically and operationally led, because that's the closest to our patients, and IT supports that. So decisions will be based on best practice and a real integrated picture of how we want to make sure that we move forward. Reliability and efficiency. Systems must optimize workflow efficiency, avoiding extra steps and redundancy. Who wants to document the same thing over and over and over again in the same encounter? We want to do better at that. In terms of our doctors and our advanced practice providers, they give us a great deal of feedback when it comes to clicks. Yes, clicks. People may not realize that, Chuck, that clicks actually matter.
Clicks are important.
Clicks are important. We don't want to. If you're in the community, I don't know if you're going through a website, we put Chuck in charge of this a lot of the time, but when people are going through the internet or going through a website, who wants to have to go deeper and deeper and deeper and have tons of clicks to get to what you want? Well, it's the same for our doctors and our nurse practitioners and our PAs. If they have to try to capture an encounter with a patient and it takes many different clicks to get there, that's overly burdensome, and we want to streamline that so we can spend more time with our community and with our patients. So that reliability and efficiency is very important. Fiscal responsibility, high priority for us. We want to make sure now, even utilizing our grant in a steward way, but in the future. So we're taking a look at how we can afford a system into the future, not just at the initial purchase and launch, which we're looking to do over the next 2 years, but also 5 years out. How can we make sure that it's a system that we can afford to stay up to date on for a long time? And then integration. Integration is ensuring that we have a seamless experience to our patients. I was just visiting a family on the inpatient areas that I asked how their experience was going, and they said their loved one is getting amazing care. Thank you to 2 East, and our hospitalists and our nurses in acute services do an amazing job. They couldn't say enough about the care, and they've experienced care in a variety of different settings, so they were so grateful. Their one statement to me that was really a challenge was our patient portal and interacting with records. So we want to make sure that we improve that. A way to do that is making sure that all of our systems talk together as strong as possible. And then finally, analytics. Dr. Artilio spent time on that. We want to make sure that we can measure what it is that we're doing and efficiently get those measurements out to reporting systems. So we have talked about where we were. Sarah gave us a great update. She gave us a sneak peek of what was going to be happening in March, and we did release some information. 2 points of information. You all helped us decide on in our journey to excellence through this particular strategic project. We decided on a project name. Chuck, do you remember what it is? It's a big one. Do you remember? Putting you on the spot, Chuck.
Wait, the one that was finally decided?
Yeah.
You mean the one that nobody chose that was mine?
Yeah. That
You
was
rejected
yours?
mine?
Oh, no. Yours was rejected, or this one was one?
No, mine was, mine, the one I voted on.
Yeah, mine too. And I think you and I might have had the same one.
We did.
Yeah. Well, do you remember what was finally decided upon?
Why do
We
you do
put
this
Chuck to
me?
the test.
No,
Care. It's okay. We'll give you one more second.
CareSync? No.
Yeah!
Oh, is it? Okay.
Yeah, good
I'm sorry. I did all the designs. I put all that together. I was just like, wait, what is it? I'm like going through every name. Yeah, CareSync.
Everybody, I put Chuck on the spot.
I got
there
it.
With that. That was for everybody else. He did it, though. He got an A for sure.
That's my first.
High five Chuck, everybody. If you haven't done that lately, he does so much detailed work. Sometimes what we're doing on a global level, we're thankful that he spends time in the details. But CareSync, everyone. And so we had a couple weeks ago launched a update in terms of how CareSync is going, and it's a very robust report. For those of you who have questioned our process, are things predetermined and pre-decided? I really appreciated that direct question that people have had. You can see from this update report that was provided to the whole network that we are following a pretty transparent process with a lot of detail to help make decisions, and they're moving pretty rapidly. As Sarah's clued us in that we were hoping in March, but we pushed it out a little bit later till April because of the due diligence to be able to do demos. And we were narrowing our particular vendor selection from many down to 2 to be able to do the demo. So this report goes over that. Just some brief highlights. In the EHR selection process, Rome Health continues to make steady progress, as I shared, in selecting the new electronic health record as part of our CareSync. CareSync initiative. Vendors selected. The EHR Executive Steering Committee has selected 2 vendors to participate in an on-site demonstration. Meditech was selected, and the Epic Community Connect platform through Extensis, Connected Healthcare Solutions. Both Extensis and MVHS are considered Epic Community Connect partners, but we have chosen to demonstrate only one of those 2 systems because they will be nearly identical to the end users. We don't want to put too much burden on those that will be helping us decide through the demo process. The vendors selected for on-site demos were based on a comprehensive evaluation of the request for proposals responses, alignment with our guiding principles, and input from the Health Information Technology Committee, or the Steering Committee, and the Medical Executive Committee. You can see in the report a very transparent process based on those guiding principles I just went over. There was a star rating of how they each one of these particular solutions measured up to our particular goals and guiding principles. And then there's, again, a great deal of detail that kind of outlines, how the process is going, the systems that were actually eliminated and why they were eliminated. Really important, because I've had a lot of questions around a particular solution and why we're not just going in that direction. This report really does balance that out and give us all a lot of information of how we're at where we are today. And again, we go over the purpose of the demonstrations. That final selection of our new EHR will be largely based on comprehensive evaluation across 5 specific dimensions. What the report also announces, which I'm really excited about, this is probably one of my most favorite pieces, is we launch the subcommittees with leaders within our network that are going to be launching teams to help us make sure that both the demos are very constructive, and then they will be the teams that head into providing the critical information for our build and launch process. So please, if you haven't had a chance to go through your emails, go through that report. It really answers a lot of questions, but again, as always, the mailbag is open, and Chuck is ready for you to ask very specific questions off that report. So it'll be really helpful. Well, everybody, thank you for staying tuned in to the updates for today. I'm pleased on our second strategic topic, which is growth. Rome Health has been through a massive growth path. We've increased our market share over the last 5 years. We've done that through our quality, safety, and access pillar. And so proud of the teams over time that have done such an amazing job transforming operations to make sure that we can take care of more patients in our community who desperately want to come to us, as well as the region. We have a far reach now here at Rome Health that we take care of people across the entire corridor of Central New York. And a big part of growth is really strategizing where and how do we continue to grow within Rome Health. To share a bit more of a deep dive on a strategic topic, there's kind of an art and a science to growth. For us here at Rome Health, our main priority is, of course, the community of Rome, the city and the surrounding zip codes, and then, of course, the county of Oneida. And there's wonderful partners, and there's wonderful stakeholder groups across the county with a lot of economic development that we're looking to make sure we have great relationships with. One such organization is Turning Stone. They are the largest employer, I believe, in Oneida County. Chuck might cross-check me on that to keep me honest and up to date.
I think you're right. Yeah, I think you're correct on that.
Oneida County is growing so well. Kudos to the county and our county executive and many people for that growth. But Turning Stone has been leading the way, and they were targeted for growth many years ago. And so Rome Health had started conversations with Turning Stone just to make sure that we could be a wonderful healthcare partner for them. So over the last 4.5 years or so, we've had great conversations of how Rome Health could be a solution to their growing workforce. And many of that workforce do reside in Oneida County, a majority for sure. And we want to make sure that we are a healthcare system of choice for their healthcare needs, particularly on the preventative side, anchoring back up to our updates. And I've been thinking about that ever since I came out to serve in Oneida County. One such individual I had earmarked a long time ago as an individual, a physician leader who understands growth in a very impactful way when it comes to patient care. So that's our guest here, who's really championed with me that relationship with Turning Stone Casino and Resort and Enterprises. And so there's been a lot of great work. I'm honored to introduce Dr. Olivia Andrade is in the studio this morning with us.
Yay!
Good morning. Yay!
Thanks for having me.
I know. Good morning, Dr. Andrade. Thank you for being with us. And maybe we'll start it out with, can you describe for us your role with Rome Health and how you've worked with me and actually a lot of people at Rome to embark on this relationship with Turning Stone?
Well, thank you so much for the opportunity. It's been
Olivia, sorry, can you bring the mic a little closer? It's a little too far. A little more, yeah. There, go ahead.
okay. Well, hi, AnnMarie. Thank you so much for this opportunity. I really appreciate it. It's really great to be working with you again, and thank you for inviting me on this journey. With the Turning Stone, it's been this partnership. It just shows like the integration of hospitality and healthcare, and to have this relationship with them now to provide access for their patients, convenience, preventative care, and such. It's just been a tremendous journey so far.
Yeah. Well, you said something really important. You said getting the chance to work with you again, AnnMarie. I'm just going to underscore the again. So we've had a chance to work together in the past,
Yes.
which was a great honor for me. Do you want to share a little bit more about your history, what you've done in the past as a physician, and how you're credentialed, and a little bit more about your specialty, and then maybe we get to talk about how you and I know each other.
My journey really began at St. Joseph's Health in Syracuse. That's where I completed my family medicine residency, and I'm board certified. And I'm most appreciative for the opportunity I was given there. And I must credit Dr. Jim Tucker for that. He was really instrumental. I started as an acting intern there, applied for a residency position, was thankfully given that opportunity. I completed my 3 years there, and I stayed on at St. Joseph's Health, initially as a hospitalist, and then a couple years later transitioned to the emergency department, where I have spent most of my career.
Yeah. I mean, I'm not an expert by any stretch in all healthcare systems and their solutions around challenging, emergency departments. We've only touched on a little bit on an AMC Connects, but I think it's pretty well published that emergency departments over the last 30 years have had a variety of different ebbs and flows of what they've needed to do for the community. But it was part of the reason why I knew that you would be a really well-prepared physician leader for what the vision was around this relationship with Turning Stone. But your clinical expertise, living and breathing and leading in emergency departments, was just instrumental, I think, for where we are today, but maybe back then a solution to some of the challenges that emergency departments had faced. What do you think about that connection in terms of where your expertise, your clinical expertise was, and leading into this phase? Do you agree with me? Do you think that there was some good preparation?
No, I certainly do agree with you. I think for me, as a family medicine trained physician, our program had a lot of inpatient services, so I was able to get a really good experience and hands-on for treating the very acute, as well as treating continuity of care.
Yeah.
And in the emergency department, you don't know what you're getting. Some of it is primary care stuff. Some of it is a lot of it is just, acute care that people have probably, not sought help for in some time, and they come in this emergent situation. We're supposed to just jump in and just take care of their needs and such. So it's allowed me the opportunity to appreciate all walks of life, certainly, and then how important access to care is, and how we should not only, yes, there's so many issues we can say there are, but how do you come up with solutions to take care of these patients? Because each one of them needs the care.
Yeah. Yeah, and you also served as medical director of the emergency department, which is rare for your background and where your specialty lies, but being elevated to be the leader of the emergency department.
Yeah, and for that I have to thank my prior leaders from the emergency department. If I may name them, Dr. Terry Witt was instrumental, and also Dr. Norma Cooney, honestly.
Yeah.
She invited me onto leadership initially as an assistant to her, an assistant medical director, and then I worked alongside Dr. Max Berube as well.
Yeah.
And so I've had some really good people to help lead me and help grow, and grow my, just in terms of my leadership and such. So it's been a really good experience.
Yeah. Thank you for that background. Chuck, Dr. Andrade is so much like some of our other guests, and like I've highlighted our culture here at Rome Health, the humility, but it's really you as well, Dr. Andrade. I mean, for people to see you as having, a different background than maybe traditionally seen to lead, a very large emergency department shows an underlying leadership skill set that was desperately needed to overcome, I can speak to this, living in that environment for many, many years, a lot of challenges that particular emergency department needed to meet, like you said, a wide range of needs in that part of, upstate New York. So it says a lot about you. Yeah.
Well, thank you. But I also think, there's this barrier sometimes between clinicians and the administrative component of the hospital. Yeah. But I think having you in that role, because you were my main administrator, it was such a seamless, we worked together very well. We were able to see, take care of our patients in our community. And also, I think as a team, my team at the time, I know, felt very comfortable with you. And we were able to bring issues forward to you and that you could then escalate to your C-suite counterparts as well and just work together. And it was just really, for me, it was transformative.
Oh,
yeah.
Yeah, it was fun.
It was fun.
So were you surprised when I called you up and I said,
yes,
Dr. Andrade, I have something.
She's like, no.
She's like, ooh, what's AnnMarie going to say next? But were you tell us, were you so surprised when I
very much so,
but you were so busy.
Very much so, but I also welcomed it because I was, I had been doing the emergency department for quite some time, and I was like, okay, what else? I'm always thinking, what's next? What do we do? Family is growing. How do I make work-life balance? We always talk about that. Yeah. But when the opportunity was presented, it was like a no-brainer to get the opportunity to work with you again, honestly, and then also for this new avenue of integrating hospitality and healthcare, and how Rome has been growing over the years, and they've you're the regional, you stand out for the clinical expertise here. So now to combine that and to be able to provide access to care for patients, to provide convenience, it's just taking away those barriers. It just seemed like a no-brainer to me.
Yes. Oh, good. I'm so glad you didn't say no. Thank you for saying yes. So this innovative approach that Turning Stone and Rome Health have started to embark upon, I love the way you word it, that entertainment meets healthcare and this creative approach. Tell us a little bit more, because it's coming quickly upon us, where this new medical center that I don't know many places. I think somebody said to me maybe Disney has something like this, but no one else that we can find in the entertainment world
yes,
has.
I mean, I think we're definitely, pioneers in this aspect, and I appreciate Turning Stone willing to partake in this and be partners with us in this. So, like you said, this started quite a few years ago, and just building this rapport and this relationship with them. We know we currently have the Aussie Wellness Center that we've evolved into from Aussie Aesthetics, and that's going really well. And now this medical center will be here before us in 3 months or so.
Yes.
So just what we've been doing so far is working with a smaller group of people at the Turning Stone in terms of getting their team members. That's what they refer to as their employees. They call them team members, just providing them some access to healthcare. So we've been doing some physicals just to get them integrated into the Rome Health system. And that way when we're open in the summer, we'll be good to go as far as getting them in for their appointments, for their screening, preventative measures and such.
Yes. Yeah. What can you share with us, maybe without over-disclosing, but here at AMC Connects, we talk about everything. When we know something, we try to make sure everybody knows something. But what can you share with us in terms of the medical center? What services will be provided there, and maybe why?
Yep. So we will be having certainly primary care services, but also convenient care or urgent care services. We want to be able to accommodate people, whether it's from the community, guests, and certainly the team members. Want to be able to provide them with access to having their preventative care. So certainly primary care is a huge component of this. Hope to implement some specialty services as well, including women's health, where one of my colleagues and partners and friend, Dr. Crystal Flint, hopefully get her to do some gynecology services there, cardiology services. So it's really still quite open what additional subspecialty services we can provide there. But really also for the team members specifically, we want to be able to get them back to work as quickly as possible. So making sure that they have the access to care and that we're able to get them back in a timely manner and also not have a barrier for them. So, yeah.
Yeah. You know, Dr. Andrade, it's so aligned with our bold vision here at Rome Health to support a healthier community and to know that we have a workforce or team members in a relationship with one of the largest employers. That's a lot of lives that we want to impact as early on as their needs. But I think what's probably different about this particular center is, and I think you said this quickly, but we'll have imaging services on site, some. But a question, and you did say this, that I get asked often as people are hearing about this launch is, can other people other than employees come to the center? Do you want to just share a little bit more about that?
Yes, absolutely. It is for the team members, but also for the guests that are at the Turning Stone Resort Casino, and also for our community members. I think having a primary care resource, having a convenient care resource is so crucial for the Oneida County area. Also, within Oneida County in Verona itself, but also the surrounding communities of Rome and Utica, even for that matter, even Syracuse. I think just having this center and being available to the community is a huge resource.
Yeah.
And like you said, you mentioned the imaging. So we will have imaging capability in terms of X-rays, ultrasound, and mammogram. So again, keeping with preventative measures for the mammogram especially.
Yeah, it's so exciting because we are hearing more and more delays and at times in terms of access to imaging, but to be able to conveniently get everything that might be needed with one encounter as much as we probably can. So we talked a little bit about the tagline. What's the tagline for the medical center going to be?
Convenience without compromise.
Yes. Internally, we've talked quite a bit about that, but as Dr. Andrade and I have continued to work with this team at Turning Stone, it seemed to really connect very nicely because that's what we're looking to do. Make sure that people that have their busy lives are taken care of really well and get back to those busy lives.
That's right.
So when is the tentative launch?
I believe we will be opening July 6th, which is the Monday following the holiday. So that's when we'll be opening up for ready to serve the community.
So exciting. And I think that's the same time their new Crescent.
The Crescent Hotel is scheduled to open June 29th, excuse me. Yes, and we'll open the week after. Yeah.
So almost like right together.
Yes.
It's exciting. Now, you mentioned one of our starting points, which was very exciting. We've talked just a little bit about this, and Chuck will probably flash up some pictures that we've had and scenes, but we celebrated our happy first birthday with
did,
Aussie
March
Aesthetics
6th.
by Rome Health, and we're evolving that particular area of service as well. Can you share with us a little bit more?
So we've expanded our services. I mean, out of this partnership, we developed an aesthetics practice and have a great team of people with Azarina, Dr. Flint, and we also have Christy Russ as well as Chance Nickerson. And we just built this really great team. We're providing services to not only the guests of the Turning Stone, but there's a lot of community members, Rome Health members, team members that come to us. We wanted to, people always want to feel good, and we want it to be beyond just the physical aesthetic itself, so we've expanded into wellness as well. We're doing weight loss. We've incorporated some peptides into this. We do IV infusions, vitamin injections, so just wanting the patient or the client to feel good as a whole from the inside out.
And you and I have talked about that there's some evolution happening with that particular kind of offerings. And so we're moving from Aussie Aesthetics by Rome Health into more of a wellness feel.
Yes.
Is that where incorporating metabolic health and some of the weight loss?
Yes, and I think we're also getting a new website, which hopefully will go live next week. So that's really exciting, and just to kind of showcase really where we started from and where we're going.
Oh, it's so exciting.
Yeah.
And happy birthday again.
Thanks.
I know. It's a big deal being able to be open over a year now.
Yeah.
Over a year from our launch and serving many people. I think, too, you mentioned Azrina. She's one of our advanced practice providers at Aussie Wellness. And I remember when I first met her and was talking to her a little bit about this space. I didn't know as much as we know today about this particular space and aesthetics care. And she said she just had a beautiful way of saying when people feel their best, and that can come from looking the best that they can just emulate their best selves.
Absolutely.
Yeah.
And I couldn't do this without the team I have. And I know I mentioned Azarina, but I also have Alina Stout, who's also going to be working at the primary care center as well as aesthetics. And, Dr. Flint, she splits her time between gynecology and aesthetics and wellness as well. So a really great cohesive team. the work that we do together and how we treat our clients and patients, it's just, yeah. And I can't thank them enough because they do such a wonderful job.
Yeah, it's a great team.
Yes.
Well, thank you, Dr. Andrade, for
Thank
saying
you.
yes to this, it was really bold vision and the amount of work that you do every minute of every day, it feels like. I have no idea, actually, but I feel like it's, you've created 26 hours in your day to help make sure this relationship advances. Thank you for that. Because to say yes to something that is new and innovative and really creative is a lot to ask, a stellar physician. So thank you for that. Chuck, I think, do we have a couple minutes to get to know Dr. Andrade a little bit better?
You know what? I think we could stretch it.
The things that don't get shared
Things that
prior
don't get
to this.
shared, right? I know. Well, Chuck, do you want to ask the first rapid fire question? I think we're curious, right? A little to get to know Dr. Andrade a little more.
Oh. Should I give you one we know, or should I give you a new one?
She can handle a new
know.
one. She can handle.
Oh, you want a new one? Oh, I was kidding. I don't have any at the moment. I wasn't expecting this. So, what is your favorite go-to gas station snack?
Do you go to the gas station?
I do go to the gas station, but I usually send my kids in to get. They're always the ones that want to get something from in there. So I'm like, just bring me back some Cheez-Its.
Cheez-Its. Oh, we haven't had Cheez-Its.
That's a good one.
Chuck, we haven't had Cheez-Its. That's great.
I like that
In
one.
moderation.
Yeah.
I'll have you know.
What is your secret hidden talent? This one I've been curious about because, as you said, I've known you for many, many years now. I don't know.
Hidden talent.
There's got to be it's just looking at you, there's thousands, I'm sure. I just don't know them.
I multitask really well.
Okay.
Yeah, that's the
That's
26
a talent.
hours.
I can't.
Yeah, I was just saying, right, Doctor?
My house could be upside down, but I will always find it. My husband can attest to that, I hope.
See, that's how she has 26 hours in her day, for sure. Now, have you ever won a contest?
I did. I have. Many years ago, this is so embarrassing. It was at the Great New York State Fair.
Okay.
I got up to sing.
Yeah.
I think it was 93Q. I
Chuck!
don't even know.
Yeah.
But it was for, I sang like a prayer.
You did not.
I did. I don't know what got into me, but I sang. And I think I placed second. They were just doing this. It was for fun. You weren't going to win anything.
Andrade.
Yeah.
How did I not know this?
And that was the end
Do
of
we get a
that.
sample?
No, we don't.
No, come on. I think we got to get a
my
sample
gosh,
here.
there's a microphone.
I have a cold.
The diva. No.
Yeah.
That's really good. I'm so glad to know that.
I'm so, yes.
Chuck, we'll have to have Dr. Andrade back on. And
That's
she's gonna
exactly
sing
what was going to come out of my mouth.
like a prayer. I haven't even heard that song.
Yeah. I do sing. I did sing for a while in the choir at my church. That I'm more proud of. Other than my
93
little
Q's,
stint.
New York State
I think I was still in high school at the time when I went up there. So it was. Yeah.
But you got second place.
Yeah, but it was a little, it was, where the butter sculpture is.
Oh, yeah.
So they had like a makeshift stage there. And then in
remember.
those years, I was probably bolder than I thought and thought I sounded better than I did. And
No.
Yeah.
Now, did you think you were going to be a singer or a doctor? How did we go from being a singer
I'm
to
really
a
not a
physician?
singer. I enjoy it. I think I can carry a tune, so to speak. But no, medicine was always because there's nobody in my family that was a physician at that time. And I'm from India originally, and people don't really seek care unless they're on death's door almost, really. They don't know the preventative care, all that is not a huge thing. At least it wasn't many years ago.
Sure.
I'm sure it has evolved over the years. But there was no physicians in my family and on either side, on my dad's side or my mother. So it was, and education was always something that was kind of expected of us. Like my parents, they sacrificed coming here, I think, for our education so that we could, do something different with our lives and something better. And so, we lived in Saudi Arabia for many years where my dad worked, and then he took a transfer here. And so, they gave us the opportunities, and so we had to, just go with it. And where else, America is the land of the opportunities. And so we all came here and we did the best we could. And I'm a physician today. My sister Flavia's a physician. And I have two other siblings, and both in investment banking. Yeah.
Oh my gosh! Yeah,
So I think my parents did pretty well. I think we're all, successful in our own right. But I think also humble, and we appreciate where we started, where we came from, and the opportunities that have been afforded us.
Oh, I love that. I love that. Do you think so? If I hear you right, part of your vision and your heart for yourself was sparked by a culture that waited too long to maybe receive care, or maybe there was
Definitely.
trust. Like, do you think
Definitely.
you've been able to make some inroads, either family-wise or in the community?
Absolutely. I am their on-call doctor.
Oh,
Whether it's my siblings, whether it's my cousins, aunts, uncles, yes,
Mm-hmm.
yeah. They have a WhatsApp. We have a WhatsApp chat, so
Yeah.
they will communicate that way, or they'll call. And these days, it's so much easier to communicate with one another, whether it's FaceTime or through internet calls and such. So.
In knowing you the years that I have, and just affirming for me, I love being right. I do, Chuck. I love being right, that Dr. Andrade was the right person to lead us through this, because we have so much diversity in Oneida County. The team members at Turning Stone were learning. There's so much
Yeah.
depth and breadth of diversity. To be able to have a physician leader that understands that there's different ways people orient themselves or not, or avoid healthcare, that we have somebody leading us and shaping a particular approach that can meet all people's needs that we are hoping to serve in this population. So thank you again.
Thank you.
Yeah,
Very excited about this.
Yes.
Yeah.
Oh, it's already exceeded expectations. But July is certainly a big.
July is around the corner.
No
It's-
pressure.
yeah.
I want to do one quick follow up though. So with the singing, okay, I know I love this. What would be your go-to song today? If we were to make you at this very moment do a karaoke song, what's your song? What would it be?
Ooh.
There's a song of that, The Prayer. Andrea Bocelli, Celine Dion did a duet together. Yeah, and I think
Okay.
one Christmas in med school for a concert, I had sang that with one of my friends.
How can you not do it for us now?
You know,
One day I will.
Okay. Oh, we got
yeah.
that.
yes,
Did you
Chuck,
hear that?
We
Yeah.
heard it.
Right
We're
there.
going to reference
Chuck,
it.
do
We
you
heard
sing?
it.
What's that?
Do you sing?
Yeah.
It's on.
Oh, I
do this.
karaoke
We
all
will
the
do
time.
this.
I karaoke all the time.
We will do this.
So we'll do a song from The Calling, and then we'll do yours too. So we'll.
Okay.
Friends, the clicks are going to go up so high. Be tuning in to AMC Connects, everyone, because we're going to have a duet right here. Not now, but in the near future. And good news, growth and this particular partnership is such a major strategic initiative, as I said at the top of our time together, that we will be having Dr. Olivia Andrade back. So thank you. You're such a good sport. Thank you for this discussion.
Thank
and
you.
Yeah, more to come.
This was a lot more fun than I thought I was going to have.
Thank you for saying that.
You're such a natural at this, and so you make it easy. Both of you do.
Thank you. Well, Olivia is so beautiful inside and out, right, Chuck? I'm
Absolutely.
hopeful that she's been wanting an AMC Connects token.
Yeah.
And that she can continue to carry that forward. So if people were wondering, we do have that for Dr. Andrade as well.
Sharing
so
the
she'll
love.
be able to take that and decorate whatever she wants. And hopefully, there's somebody in your life that will want those so much that she can sport them too.
Yes.
Because she's got such a great taste. Well, thank you again, Dr. Andrade. And
Thank
Dr.
you.
Andrade did take note of Dr. Flint, who we have had on an episode. I think Dr. Flint is one of our highest watched and liked episode, AMC Connects. We really do love her. We recently made an announcement about her practice and just wanted to highlight that here on AMC Connects as well. Chrislyn Flint, MD, now accepting appointments at Oneida Menopause and GYN Center. Oneida, New York, Chrislyn Flint, Dr. Flint is now accepting patients at the Oneida Menopause and GYN Center and part of Rome Health. Opening Thursday, March 19th, the new practice is located on Genesee Street, Suite 3 in Oneida. To schedule an appointment, please call 315-606-1580. Over the past several months, Rome Health Obstetrics and Gynecology provided temporary office space in Rome so people could continue their care for her patients while preparing for transition back to the Oneida area. A board-certified gynecologist gynecologist. Dr. Flint offers comprehensive gynecological care for women of all ages, special focus on helping women navigate the transition of post-menopause. We talked a little bit about that when we had Dr. Flint on an episode, real passion of hers, and has spent a great deal of time serving women in this area. Menopause is a significant and often misunderstood phase in a woman's life, said Dr. Flint. Many women feel overlooked during this transition, and I want my patients to know they're not alone. My goal is to provide care that is not only medically sound, but also emotionally supportive, so every woman feels heard, understood, and empowered. Thank you, Dr. Flint, for all you're doing, and thank you to everyone for creating the best care out there here.